More than 4,000 monkeypox cases have been reported worldwide in at least 50 countries since early May, according to the U.S. Centers for Disease Control and Prevention. Observers say the current outbreak raises serious concerns. However, the World Health Organization has announced that the global monkeypox outbreak does not constitute a public health emergency of international concern, at least not for the moment. For more insight, I spoke with Dr. Mary Stephen, a technical officer with the WHO Regional Office for Africa.
Public health emergency of international concern is an extraordinary event as defined by the international health regulations that puts states at risk of transmission, especially through travel of any potential public health threats. So the emergency committee met last week and advised the DG that the current multi-country monkeypox outbreak does not constitute a public health emergency of international concern yet. But also the mechanism, the way it works for the IHR, if for instance there is a rapid evolution of the outbreak, the DG can convene another emergency committee to look at the available data and advise against. Secondly, it also does not mean no action. Countries have been called to take action to make sure that they are alert, ramping up surveillance to detect cases, the capacity for laboratory to confirm these cases, contact tracing, to also care for those that are sick, and make sure that the population is engaged so that people understand how it's spread and how they can protect themselves.
What do we know about the origin of this outbreak and the human-to-human transmission?
For those countries in Africa that are endemic, we know how these transmissions are happening, but more information is needed to understand the transmission mechanism in those countries, especially in the global north, where this outbreak has not been documented before and there has been no link with international travel.
A majority of early cases with this particular outbreak were identified in men who have sex with men, which raises the question of sexual transmission. What can you tell us?
As far as we know at the moment is that it's still through direct close contact. But of course, more research is needed to either establish or discard the fact that it can be transmitted sexually.
Monkeypox, as you mentioned yourself, it has been circulating in a number of African countries for decades. Some critics have mentioned a double standard because of the attention it's receiving now that it has spread in Western countries. What is your reaction, and how will this current outbreak change the approach in addressing monkeypox globally and also in Africa in particular?
The current outbreak provides an opportunity to ramp up effort, especially in countries that have been endemic, but also the concerns about the spread in places where monkeypox have not been documented before and there is no link with international travel is legitimate. But also it provides opportunity to ramp up control measures. And the new discourse around the medical countermeasures, the issues of vaccine that have not been thought about before in Africa, I think it's a good opportunity really to understand the virus better and also to ramp up some of those control measures.
What is being done to prevent a shortage of vaccine supply, especially for low and middle income countries, because there have already been reports about shortages in some places?
Vaccination against monkeypox in the general population is not recommended at the moment. It's limited to high risk, either contact health workers, laboratory workers, but it doesn't mean that we shouldn't be ready and begin to make sure that this vaccine is available. So there is a vaccine that has been approved since 2019, the smallpox vaccine for the prevention of monkeypox, and WHO is discussing with partners in terms of the coordination mechanism for access and ensuring equitable distribution for this vaccine.
What can you tell us about the way the virus is currently behaving on the continent?
We have seen cases, for instance, confirmed in Ghana, in Morocco, in South Africa, and these are countries that are not endemic, but also endemic countries, Democratic Republic of Congo, Congo, in Brazzaville here, Nigeria. In Nigeria, for instance, the time they had before this 2017 was around the 70s. So it was a disease that re-emerged, but the country had built capacity. We have also seen suspected cases reported in countries that have not documented monkeypox before. So this is what we are seeing happening on the continent.
That was Dr. Mary Stephens with the WHO. Now, the state of global health emergency by the WHO only applies to the coronavirus pandemic and polio. And that's our health report for today. To stay in touch, find me on Twitter @Linord Moudou.